right, so we are going live now. All right, I just wanted to say thank you for joining us via Zoom and YouTube and in person this morning. My name is Ashley, the Public Information Officer with Southwest District Health. I will be your live stream moderator for today's session. Please note the following. Please be mindful of your conduct in today's meeting, as this is being recorded and will be made available for later viewing at the Southwest District Health YouTube channel, and that's youtube.com/Southwest District Health. We welcome any email, comments, questions, and feedback to publichealthidaho@phd3.idaho.gov at any time. Just some notes for those that are Zooming in. Please feel free to direct any virtual or Zoom related questions, comments, or concerns to the moderator, myself, in a private message, and we can work to troubleshoot any issues that you encounter during the session. Please remember that if you're not directly participating in a discussion at a particular moment, please mute your microphone and turn off your video feed to preserve bandwidth on today's call until you are presenting or contributing. And for those participating in the meeting room, and for our board members, please remember to press the unmute button on the microphone when ready to speak. If possible, please identify yourself prior to speaking and speak clearly and about 4 inches away from the mic optimally to get the clearest audio for our remote viewers joining us this morning. And when not speaking, please mute your microphone. And then a new note here, if you do have any cellular devices or tablets that have cellular capability, please make sure that is a little ways away from the microphone because it may cause interference. That is something we did discover through some troubleshooting recently. I will now turn it over to Chairman Commissioner Elliott to call today's meeting to order. Thank you.
Okay, thank you very much. We'll call this meeting to order and start with Pledge of Allegiance. Would you please join Commissioner Hannigan? To the flag of the United States of America and to the republic for which we stand, one nation, under God, indivisible, with liberty and justice for all. Okay, thank you very much. We'll have roll call now. Looks like everybody's here. Georgia Hannigan. Lyndon Haynes.
Here.
Carrie Smith.
Here.
Kelly Abrasturi.
Present.
Vicki Purdy. Dr. Sam Summers.
Present.
And Brian Elliott here. Okay, thank you. Has everybody looked at the agenda? Is there any request for additional items or changes to the agenda? If not, I would stand for a motion to approve the agenda.
Chairman Elliott, I would make a motion to approve the agenda.
Thank you. Have a motion to have a second.
Commissioner Haynes, second.
Okay, have a motion and a second. All in favor, say aye.
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 Thank you very much. Minutes from October 26th. Any changes or additions to the minutes as presented? So everybody had a chance to look at those? Oh, okay.
Summers, I'd move that we accept the minutes as presented.
Okay, I have a motion to have second.
Commissioner Haynes, second.
Okay, thank you very much. Motion and a second. All in favor, say aye.
Aye.
Aye. Motion carries. Okay, we're a few minutes ahead, which is good. We have some folks that came today from the public. We haven't had anybody for, about 4 months now. So appreciate your interest. We have 1, 2, 3, 4. Has anybody, I guess everybody has signed that wishes to comment. We'll have about 15 minutes, so if you would, please keep your comments to the point so everybody that signed here, which there's only 4 that signed up, will be able to speak. Okay? If you'd come up and sign in so I know we all know who's talking, speaking to us.
Good morning.
Morning. Do we have a microphone or, okay, we're set up there. I guess please come to the table. If you would, please state your name, just so that, because it's being, so everybody can hear anyway. Start with Rick Wortman. Nope, doesn't matter. Okay.
You might want to make sure the microphone is on there.
Oh, yeah. Should be a switch. Okay, that's on. All right.
Good morning, Madam Chairman, members of the board. My name is Rick Wortman, and I am a concerned parent. I am a member of the Power to Parent Union. I'm interested in discussing the on-site vaccination clinics, school on-site vaccination clinics that I'm aware have been considered being conducted here. I know that there have already been some conducted throughout the valley. I have more concerns and I have questions about these on-site clinics. I am a registered nurse, by the way. I retired from active nursing in 1993. I have 2 children and 8 grandchildren. I'm concerned about the welfare of the children, and I'm concerned about the rights of parents. I'm obviously not anti-vaccination. I've been vaccinated myself, but I do question the necessity of these school clinics being the fact being that there is plenty of opportunity for the children to receive their vaccinations. St. Luke's and St. Alphonsus are both conducting immunization clinics. The personal physicians, family physicians, and pediatricians in the area are all have the children's vaccines available to administer to the children. So I don't see quite the necessity for conducting on-site clinics in the school and taking time away from the school, from the classroom for the children, considering that as much classroom education as they have lost over the last 18 months. And now we're going to introduce another interference or infringement on that time to conduct on-site clinics for these immunizations. And I am concerned about the effect of the school immunizations and the clinics themselves on the children. Obviously, as I mentioned, the infringement on their classroom time. I'm concerned about their peer relations. What happens when these children who go to get their immunizations, albeit they may have had parent approval or consent, and they come home and they come back to the classroom and they've got their Band-Aid on their arm and the other kids don't. And now you've set them up for peer conflict. And then there's also the issue of personal privacy. Obviously, in order to safely conduct the immunizations, they're going to need to be collecting personal health information about the children as far as their health conditions, their contraindications to immunizations, their allergies, etc. And who's going to be the control of that information and dispensing that information and who's going to make sure that the HIPAA privacy is being taken care of for those children? Again, I don't know who's conducting these clinics. I don't know whether it's being conducted by the health department itself or whether the health department is contracting this out to some agencies. I do know that as far as standards of care are concerned, there are reports already of children being vaccinated who did not have parental consent because their identity was confused by the teacher who sent them to have their immunization. There are reports of children receiving vaccines that they should not have received. They've received adult dosages of vaccines rather than children's dosages of vaccines. There are reports of children who have had to been taken to the school nurse later, subsequent to their vaccination, for reactions to the vaccinations. Those reactions should have been taken care of at the clinic. Somebody at the clinic should have been observing and be taking care of those children for reactions prior to releasing them from the clinic. So I don't know who's conducting the clinic, whether they're licensed personnel or whether they're not licensed personnel, whether they're medical health personnel or not medical health personnel. Those are all kinds of questions that I have about the safety, the efficacy, the necessity of those shot clinics, and the impact on the children themselves.
Okay, thank you, sir. Jason Gallagher, if I'm reading it correctly.
Yes, you did.
I, too, am concerned about clinics at the schools. Schools are not medical clinics, and there's plenty of, as we have seen, the promotion of getting children vaccinated we're being throttled by it. It's everywhere, and what a great thing it is. So if a parent chooses to get their child vaccinated, there is plenty of places they can go to get them vaccinated if that's what they choose. Sending a child to school and being open to this at the school without their parent being there to protect them, I think it opens up the children to peer pressure and to possibly being bullied for either not getting it or getting it if that is seen, if they're seen going into whatever, the room or the box or wherever this is happening. It's just open and it lends to no privacy. Being at the school, I feel there's an element of possible coercion with the kids without parents being there. So those are my concerns. I also heard a report on the studies of giving this vaccination to children, and 1 out of 1,300 children that were given this vaccination was paralyzed and is now on a feeding tube. 1 out of 1,300. So if this is an ongoing statistic, do you want your child to be that one in that 1,300 that gets paralyzed and is now on a feeding tube? So there's a lot of concerns about this, not just the school clinics, but just giving this vaccination to children in general. Thank you.
All right, thank you very much. Next, Mike Miller.
Hi, my name is Mike Miller. Mr. Chairman and board members, thank you for allowing me time to speak today regarding vaccine clinics at our schools. I was at the Capitol all day yesterday listening to testimony regarding vaccines, and will be again today after leaving here. The majority of Idaho residents support medical freedom, as do I. With that said, I am formally requesting that this board bars the Caldwell School District from holding or facilitating any vaccine clinics on school grounds or during school hours. Parents and legal guardians have a plethora of options available to them if they wish to have their child vaccinated against COVID. I believe that there are way too many concerns associated with vaccine clinics, from the potential for the wrong students to be injected with a substance that their guardian did not approve, to the questions and potential legal issues surrounding implied consent and age of consent. Again, I am requesting that you not allow public schools to offer or facilitate vaccine clinics on school property. Thank you for your time, and I'm available for any questions if there are any.
Next, we have Heidi.
Good morning, board members. Thank you for giving us this time. My name is Heidi, and I have a student in this district, and I am a member of Power to Parents. I'm opposed to the continued barrage of vaccines and masks overbearing our children's lives. I do not agree with the clinics being brought to the school, especially during school hours. I'm afraid of a child potentially being harmed by these injections in front of their peers. I'm concerned about the lack of verification conducted at these pop-up clinics. I personally know of a case where forgery was conducted by a student that received the vaccine without the parent's knowledge. That would be my daughter. Respectfully, I ask that you help us to reestablish the right to parent our children as we deserve and are blessed with. The position we hold together from here on out will rely on your actions. The current climate has made us an enemy to our nation for protecting our children, and it is personal. I'm asking that you stop this divide. We need your help, not your harm. Please stop the persistent encroachment on this medical experiment with our children. There are places everywhere if that is your choice. All of us have been mentally and physically affected, and you have the ability to direct the situation in the privacy and hands of the parents and their children within their own homes and doctors. It is my hope that your conscience will be your guide and let the educators get back to their job of teaching, not vaccinating. We need to know who you serve. Thank you.
Okay, thank you very much.
Chairman Elliott, may I ask a question for clarification to her?
Yes, ma'am.
I don't remember her name.
I'm sorry,
Heidi?
Yes.
Did you state that your child was, and I don't know if I can ask, how your child was vaccinated without your permission?
Correct. She was 2 months from being 18, and this was not in this state, but it was with the health department that she went to and forged my signature and got the vaccination.
Okay, thanks.
Okay. All right, thank you very much. Kayla Dunn.
Hello. Volume up? I don't think I need it. I have to. Okay. Well, hi, I'm Kayla Dunn. I am the state director for Power to Parent Idaho. And in May, I was here testifying when the resolution was signed not to infringe upon our individual liberties as it pertains to COVID-19 and any variant thereof. And when I was there, I said that I would be back and that I would do anything to protect our freedoms. And now I'm here. And that is why I'm speaking today. And so we are rallying parents, we're informing, and we're educating them. November 8th, I received a message. We have 5 different chapters in different states. One of the states that Power to Parent has a chapter is in Maryland. And so my Maryland state director contacted us, and they said that the wrong child was vaccinated. She was 6 years old. She came home with a Band-Aid on her arm, and her mom said, "What's that?" And she said, "Well, I got a shot today." And the mother said, "Well, I'd never consented to you getting a shot." So it turns out this young lady had the same first name as another lady in the classroom. And so this happened. We were well aware of it. And then eventually the Calvert Health Department released a statement apologizing to the families for this incident happening. And they also paused all of the clinics. And so we're hearing that this is happening across the country. We're also hearing that children are receiving the wrong dosage. They're receiving adult dosages across the country. And so I agree with everyone who stood up here to speak. This should not be happening in schools. It's taking away from educational time. Do we really need to see this happen? The same situation happened, like Maryland. We don't need that to happen here in Idaho. We have enough problems as it is. So I'm asking this department to pause all of the clinics. First and foremost, we need some more time to understand how this is affecting our children. We want to know who these medical professionals are, or if they are even medical professionals. We want to know about the dilution of these vaccinations. We need to know all of this information. And I think that you're making it a little too convenient for parents for parents to send their kids to schools to receive this vaccination. And I'm going to go there because I've been watching these different school districts, and for some reason, Caldwell School District seems to be the target. And I'm looking at the low parental involvement in the Caldwell School District. I'm looking at the high population of the Hispanic community in the Caldwell School District. These kids are not shields, and so I'm sick and tired of people talking about children and how they should protect the adults. Since when in history are the children supposed to protect the adults? Never. They are not shields, and they are not experiments. So let the doctors do their jobs. I don't know anyone in this building that have ever sent their child into a doctor's office to receive a vaccination on their own. So we should not expect parents to send their kids to school, technically to a doctor's office on their own to receive a vaccination. Please pause these clinics immediately. Don't let this become another Maryland or another Utah or all of the many states that are reporting these incidents with these children. Thank you so much for your time, and I'm happy to answer any questions.
Okay, thank you very much. Questions, anyone? Okay, thank you. We appreciate that information.
I have one more lady who's asked for the chance to speak.
Okay, if we're brief.
medications. We have multiple identifiers when we give medications, vaccines.
My apologies, Mandy. Would it be possible for you to please pick up the microphone or turn it on? I think it might
Turn
be
it on first.
Oh, perfect. Thank you so much.
Can you hear me better now?
Yeah.
Is this working?
Yes, you sound great. Thank you.
You're good? Okay. Do you want me to start over? Okay. My name's
Yes.
Mandy. I'm a nurse. I work in a hospital. And my concern over giving these vaccines at schools is, what are the training of these people getting that are giving these vaccines? You know, we're trained in the hospital to look at multiple identifiers, medical record numbers, first, last name. We're trained on side effects. We use a computer to scan barcodes. We have, you know, multiple identifiers. My concern, again, is like what Kayla said. Is some other kid going to get this vaccine that shouldn't? Is some teacher going to make a mistake, give the wrong paper? You know, I would be pretty upset if that was my kid that got that vaccine and I didn't want them to. I could see lawsuits coming if that happens here, because that's what I would do as a parent, because I'd be pretty upset. That's all I have to say.
Yes.
Thank you, Chairman Elliott. Nikki, are we sponsoring or are we holding vaccine clinics in the schools?
Commissioner Smith, I would have to defer to Jamie to see if she has more information. I know we've done some adult clinics. I don't know that we've done any children vaccination clinics at this time. Jamie, do you have more information?
Yeah. I've asked Robin Stewart to join, and she can address that question. Robin?
Okay, while she's coming or getting ready, has everybody had a chance to read the comment that came in electronically also? Okay. Just want to make sure everybody's had that opportunity to see that. So I guess as soon as Jamie's ready, go ahead.
Robin, are you available? I don't know if she's...
Vicki, she's not answering, so let me get some information and we'll come into the room.
Thank you.
The other last question I would have, I don't know if we can answer it right now, but if we're not hosting the clinics that are in the school, do we have any authority? The specific request was to not allow the vaccine clinics in our school. Do we even have that authority to stop a clinic?
No, as Commissioner Elliott is also saying.
Yeah,
no.
Absolutely not. School board is its own board. They're their own elected officials. They were elected by the populace in that area. They have their own money, their own tax money, and we have no control over what a school board does or does not do.
So the only control we would have is if we're helping with any of those clinics, we could pull back support.
Correct.
Okay.
Yeah, Commissioner Smith.
Either one, who is first there?
Yeah, that was my comment too, is because we did do some clinics close to schools. I don't know that you said they were on school grounds in the high school, I believe.
I would really have to defer to our staff on the locations of where they've given vaccines. They've been at long-term care facilities and employers, and I'm not sure on the school side what the status is of that. So I want to make sure we provide accurate information on that.
Okay. And regarding the vaccines that we're giving to adults, correct? What is the training procedure and the storage, and which ones are we giving? If you don't mind just elaborating on that a little bit.
Sure, Commissioner Purdy. We provide, we are giving in our clinic, I know, youth vaccinations at the dosage that, sorry, there's a lot of feedback, at the dosage that's recommended by the manufacturer, and same with the adult vaccines. And I believe right now we're giving maybe we have some staff here that can probably help support or provide more information on this, but yeah. Oh. Okay. Is that better? Ashley, can you still hear me?
Yeah.
Maybe not.
Yes, we can hear you just fine. There's no feedback on this end, so it may be an audio issue.
Oh. Okay. All right, good. Well, I'm glad we're at least being heard somewhere. We are offering all the approved adult vaccinations in our clinics. And regarding to storage and handling, we follow the manufacturer's recommendations for storage and handling. And our staff receive training from the state immunization program, and there's also the CDC also has offered training as well. So that's where our staff receive their training. And I'll maybe just pause there and see if Robin has additional information to share and can talk what, if anything, we're doing with schools at this time.
Oh, Robin, please make sure the microphone is on.
Can you hear me better now?
Yes, thank you.
Okay, so my name is Robin Stewart. I'm COVID program manager here at Southwest District Health. And everything Nikki just said, our staff are trained. They go through the IIP, storage and handling training. And then with the schools clinic, we were approached by Cindy Cross at Caldwell School District. For all we know, it was all approved by the school board. So what I know is that she had it approved by the school board to hold this clinic on tomorrow and on Thursday. Cindy Cross.
Who did you say was doing the clinic?
Caldwell
Okay.
School District. We were approached by Cindy Cross from Caldwell School District to run this clinic tomorrow. There's 3 different schools tomorrow, and then I think there's 3 or 4 different schools on Thursday.
So I'm sorry, correction. They were asking us as the health district to run the clinic, correct?
Yeah.
Okay.
And from what our understanding was that it was approved by the school board.
Chairman, can I ask a question? It's Commissioner Haynes. So how will the operation of the clinic go? I'm assuming parents will not be present necessarily when the vaccines are given. They're given during school hours, is that correct?
Yes, that's correct. Sure. We send all the consents out ahead of time to the school, and they send them home with the students and get the signatures. The parents fill out the form, the consent form, and they sign it and send it back to the school.
Thank you. My concern would be, I have a 10, 9, and 6-year-old. I would feel extraordinarily uncomfortable having my child receive a vaccine without me present. Maybe there are parents that are different than that. If I were to get a flu shot here today, I believe, have to show my identification to receive that. How do we do that with children? I do think there is a legitimate concern that you could mix a child up completely on accident. No one's doing it on purpose. And if my child got that vaccine and I wasn't present, I can tell you it would not be pretty, right? I would be extraordinarily upset. So I don't know how the other commissioners feel. I'm pretty uncomfortable with the idea of that happening during a school day without parents present. That's just me.
Thank you. This is Commissioner Smith. I would agree. I think that the peer pressure is too great. I know that I'll just admit my children sometimes sign my name. They are sophomore and a junior in high school, and the Band-Aid issue is real. And even the pressure from some of the more liberal teachers is real in the school system. And so having that mark for the day or two will separate and further divide this country within our children. And it's not fair. We should not be putting our, and to you, bless your heart, like this wasn't, like this isn't about you. It's about the schools and the choice that they're putting our kids in. It's very sad. I don't personally support it, and I wish that as a board we could make sure that we're staying out of. That was the point of that original resolution. We were getting a lot of pushback that the schools were taking the health board's recommendations and forcing it, and I'd like to stay out of parenting children and family choices.
Yes, go ahead, Vicki.
Yeah, I feel exactly the same way. My granddaughters, we don't want them vaccinated. Their parents don't want them vaccinated with this. It isn't actually even a vaccine. So, but I guess I am a little upset that this is a big deal, and it wasn't brought to the board for the board to discuss it and vote on it. It's already been planned, and we just went along with the ask of this Caldwell School District. And I would definitely like to see documentation from the Caldwell School Board, and who actually voted for this, because you just said you were asked to, but you didn't see any documentation or any signed. Was there a vote on it at a meeting? I mean, this is important. We as boards should be voting on whether or not we support this stuff. So it was never brought to us, and that's unacceptable.
Commissioner Elliott, may I provide some additional information for just all of the board's awareness? It is not unusual for us to coordinate with schools outside of COVID-19 to help with students who are trying to come in compliance with vaccine recommendations or requirements for school attendance. So outside of this specific incidents, I guess is the right word, it is part of our routine operations to help support schools in our community and ensure our children are ready for school and vaccinated and meeting those requirements. So it's my oversight that I guess the board should have been involved in a decision on this matter, as it isn't something that we would normally do. So I'll take responsibility for that. I guess my comment, Nikki, I do think that has happened in the past. The difference is it isn't putting it out there for all children. It's I'm enrolling and this child isn't vaccinated, and it's help in a smaller scale versus the politicized world that we live in right now. And so I think just keeping that in the forefront of is the only difference.
Yeah, and I do think, sadly, a lot of our job as the board is managing liability. That's been one of the more depressing things I realize as the county commissioner, is that's really a huge part of what we do. I do think this is an area where you have a lot of liability, especially if there is a mix-up, completely unintentional, and not nefarious in any way. But if we were to give that vaccine to a child whose parent didn't consent and that parent isn't present, I think that's not good in a lot of different ways, and I think the liability of that in and of itself is kind of frightening to think about. So I just think that's another aspect. If we take the politics aside, whatever, you get down to just the liability of it, which sadly we have to consider. I think that's a very high liability area. I feel deeply uncomfortable having someone get a shot without their parent present. I don't feel good about that at all.
Commissioner, yeah. I appreciate all of the comments and concerns about that. I know we don't have this as an item for action on the board agenda, but I'm happy to talk to my team about whether we proceed or not, unless the board wants to handle this situation in a different way, I guess. And definitely can hear your concerns about potential liability, and I certainly am okay with us continuing to provide the vaccines or make them available to youth in our clinics, where a parent can, or a guardian can be present with them as an alternative.
Chairman. Yeah, thank you, Nikki. I appreciate that. I just think that's probably a better way of handling it than having kids. I was a kid who just kind of went along. And so if my parents wouldn't have consented, but they would have called my name, I would have sat down and got a shot as a kid. And I wouldn't have said a word because I didn't want to cause a stir, right? I mean, that's just a child I was. So I guess I think about it from that perspective. If I was in that classroom and they called my name and my parents wouldn't have consented, I just would have went along with it. Because I would have thought, I'm supposed to do this. The teacher called my name and I'm supposed to go. And that's concerning.
Yes, thank you, Commissioner. I feel the same way. I mean, a kid is a kid, and they're not really prepared to withstand the peer pressure that an older person hopefully has had enough experience to be able to make their own decision and stand up for. So I also agree with what you said, Commissioner Haynes. And others. I was one of those kind of kids, even if it was in high school. I don't know how many times I found somebody to sign my mom's name, so I could go skiing on Tuesday or whatever, and that just happens. That's, maybe less today than it was because they were pretty loose back then, but still, they're not adults. To me, that's the point. They're not adults. They're not, should not be responsible for making decisions without having enough life experience to make certain decisions. And like you say, the peer pressure it's tremendous for kids today. And I also feel very uncomfortable with us doing this, and especially without it being brought to the board. This is a really political hot potato, has been, and will continue to be. And we need to be very careful about what we approve and what we participate in. I think, as that's my personal opinion, we just need to be very careful about these. I mean, even though we have, a mandate as a health entity, we need to take a look at all the sides, because it's not the way that it used to be because of the politicalness and frankly, just the amount of discrepancies that there have been with this particular pandemic. So anyway, we are way over our time, unless there is something else somebody wants to bring up on this particular topic.
I've reviewed the Caldwell School District Board minutes for November 8th and October 25th and October 14th, and the board did not make any formal action to host a clinic.
I wonder whether some of that was just done by individual schools also.
And it might be within the superintendent's
I had that
authority.
concern. Thank you. Thank you for that information. Is there a direction that we, as a board, wish to take? I mean, we can't do anything really because we don't have an action item on this, but as far as informational or directional?
Well, we don't have an action item on it. I think that we do have a opportunity, is there not, for an emergency situation, and I would like to make a motion that this district does not participate in any vaccine clinics, or at least pertaining to this particular vaccine that, again, is not a vaccine. I would like to make a motion that we do not do that. There's something that we're kind of forgetting here. This is still experimental, and I don't want to be experimented on. And there's the makers of these vaccines are not standing behind them. Supposedly the government is, and we have dozens and dozens, actually hundreds of thousands of injuries from these shots that aren't being addressed. A 28-year-old cyclist from Idaho just put up a video a couple weeks ago that he is having myocarditis, which, I'm sorry if I didn't pronounce that correctly, but several different kinds of problems with heart issues. His life is ruined, and nobody is doing anything about it. There's no help for him at all, and this is going on all over the country. So that is a huge issue, and these vaccines, in my opinion, should be completely stopped. So I certainly don't want to participate in them. And I'm sure Dr. Summers is going to say that people are dying from it, but I have personal experience that if you treat people, they don't die. So we don't need to be giving this to our kids. I agree with Kayla. This is not to protect adults. This is a governmental thing, a money-making thing. This is not what we need to be doing. I absolutely do not support this board supporting vaccine clinics at schools.
Okay.
Dr. Summers,
Yes,
this vaccine is safe, and it is a vaccine. What we forget is, and a good example is the myocarditis. What's the rate of myocarditis in people who get COVID? It's higher. So if you take 1 million people who get COVID, 5,000 people die. And I'm going to back up, because when J&J came out, there was a concern of cerebral venous sinus thrombosis, which is a rare event. There were 6 in 6.6 million people who got that. J&J for a while stopped giving the vaccine. Guess what the rate of cerebral venous sinus thrombosis is in the country? 1 in 1 million. So if you're looking at it from you lost one person from the sinus thrombosis, but you saved 5,000 lives.
Okay. All right, thank you. Comment?
Commissioner Elliott?
We,
Oh, sorry.
mm-hmm. No, I know we can't do an action. I know that was put out as a emergency thing, but I don't think that fits the qualifications of that. So I'm not even going to ask for a second on that, because I think it would be illegal.
Commissioner Elliott?
Yes, ma'am.
Could I propose that we, at the district, do not run any clinics where a parent or guardian wouldn't be present, and then we can coordinate with schools if they want to do something after hours where parents could be present, and then it's up to them to...
Yeah, I would support that, because at that point, whether somebody believes the vaccination is, experimental or safe or whatever, the parent or the guardian is an adult and can make that decision for the children. And I would support that.
Okay, then we'll move forward with that direction.
Okay, thank you.
Thank you.
All right, let's move on. A while ago, we were scheduled for our open discussion. I think we've kind of done that, but also septic follow-up. So was there questions? I know that we're asked, Commissioner Purdy, you had questions from the last meeting, and I think that's what we're trying to allow some time for. Go ahead, please.
Yeah, thank you. We've still had problems in our county. I'm still getting calls from people. I've got calls from your county, from that same subdivision, people buying lots in that same subdivision to the gal that was here, Wendy Rojas, I believe is her name. So she's got, I know you've heard from her many times, but there's apparently neighbors, and I guess the district has told the neighbor that
let's not go to third party.
I hear you.
Here. I've heard this story. I've been involved with this.
I get it. So my question
personally, and it's not the way that it's been presented.
Okay. So my question is so from my standpoint in my county, I'm getting calls from installers. So of course they've been already approved and now they're being pulled back. can we just, in situations like that, have a soil test taken so that there's no questions?
Commissioner Purdy, I think there's probably instances where a soil test would be a viable option. We'd probably proceed with that. If you have specific examples, I think that would be easy, or not examples, but specific instances, I think that would be easier for us to address because each situation is different. And
yeah,
I know of several.
and I do. So.
Oh, Mitch is apparently behind me.
You, yeah. Well, and the other question is some of those, some of the ones that are in a floodplain have been told that they have to wait another year. They've waited a year. So I guess I wanted to see that clarified.
Sure, since I know that Mitch is behind me,
right.
I would like to defer to him to help address some of your questions. Thank you.
Could you repeat that question just so I can make sure I answer it right?
So in my area in Adams County, I've gotten some calls from installers again. Mr. Paradis is one of the installers. It's not our commissioner. He has a different, I can't remember his first name. Anyway, so he has an approved septic. He's not the only one. There's been several, and now they're pulling it back. So saying that the soil type is different than what he was originally told. So my question is in order to alleviate all of this, seems to be an ongoing problem, and it's always the soil that is changed. And we do know that one septic, when you did test the soil, it was adequate. So how about we just test the soil in any situation that's like this from the very start? If it's a situation that's going to be pulled back, you're going to take somebody's permit away, because these guys could have had their house dried in by now, and they could have been doing it over the winter. But now, because of the septic, they're completely stalled, and they don't even know what to do.
And I'd like to review that permit because I haven't seen that one. I didn't know a septic permit was pulled back. So you said it was for Paradis?
Yeah, no, that's the installer. I'd have to look at my notes for the name, but I can get that to you.
Yeah, because usually I haven't seen them being pulled back for anything like that. But yeah, we can do soil testing. It's usually up to the responsibility of the homeowner to do that. But we've had a little bit of funds where we've been able to conduct some soil testing. So we're more than happy to work with somebody on a situation like that if we think it's between a C2 soil or an unsuitable, and it's something that we can help them work towards.
Okay.
I think that the water may be some of our big issues, and I don't know if that was the case with that one. But
no, I don't think it was. I think it was just the soil. But the other one was, and this is in Commissioner Elliott's district. So I said you guys need to call him and talk to him about it. But that is a question. I mean, so we supposedly were in a drought year. I don't know that we were in a drought year. We've had an awful lot of makeup rain, maybe you want to call it, whatever, in the last few months. So are you saying we were in a drought year and that you have to wait another year to give somebody a permit after it's already set for a year?
So what we're coming back to, probably in your area, there wasn't much of a drought year. The mountain runoff didn't affect you as much. Some of the areas down lower, we do have some drought problems. And there was actually just a really good news article yesterday on Channel 7 that talked about what I think we're at 90% drought rate throughout the state of Idaho. And the good thing is we're actually going to talk about this at next meeting. We're going to come in and talk about groundwater monitoring and some of the flows that we've had. We've been working in Jim County. I think we've got like 1,600 data points right now. So we're going to be able to present that to you guys. That's going to show what we're seeing as far as groundwater monitoring in that area. And that's never been collected before, so we're excited to show that. And we're going to talk about some of the drought things that go on. The technical guidance manual does allow us to monitor for an additional year if we are in a drought situation. So we'll discuss that at the next meeting. But I think some of the issues in Jim County I think that you've been working with or hearing from individuals over there, isn't so much that they've completed the whole year of groundwater monitoring. They've completed parts of it. So they haven't completed all their requirements with groundwater monitoring is what we've seen. So, but I'm more than happy on it. If I can just find out which ones those are, then I can walk through that process to just put it into, one, just central, like everybody's doing this. That's too hard to do. But specific ones, we can narrow them down and figure out what the issue is or if we're missing something. So
I think that subdivision, and I'm just asking this for my own information, where it's in a high groundwater area. So I don't know, I think those lots are like 5 or 10 acres. So I guess my question would be, is it possible if these lots were like, say, 20 or so acres plus, I mean, I don't think we're probably ever going to be in a situation like that in Adams County, except for if they decided to ever develop on the valley floor in New Meadows, which there are some situations there. The size of the property, would that help? The depth of because there's always subsurface water in a lot of these places in Idaho, particularly in our area, New Meadows, I guess, but in Gem County and other areas.
So that specific area that we're talking about, we've measured water as high as 5 inches. And the Department of Environmental Quality does not give us a grace period on that. We can't get any higher than 12 inches. And so when it's at 5 inches, doesn't matter how big the property is, if human sewage is leaking out into it and it's going through the groundwater, it could be 100 acres. I mean, they don't give us any variance for that. So, and that's kind of what we're dealing with is, 5 inches, 6 inches, some of it 1 to 2, some of it above ground when we get out there and we're walking in it. So no, I'm sorry on that one.
I'll get you the names of the one that I just heard about. So that's in Adams County. So thank you.
I greatly appreciate that. Yeah, we'd be more than happy to work with you on that.
Okay, appreciate that.
Thank you.
Any other questions or comments for Mitch? Okay, thank you, Mitch. We appreciate your information. And we'll beat up on you again, let's see, about 11:30, is that right?
Yeah, this won't be bad.
Oh, okay. All right. Okay, we'll move on then. COVID-19 letter to the governor follow-up, and we'll turn that time to Nikki.
Well, I'm hoping I'll catch us up a little bit here. I don't have an update. I thought I might. At our last board meeting, I think I shared that I had a meeting scheduled to talk to the Idaho Office of Emergency Management and Department of Health and Welfare staff, and we did have a call a couple days following the last board meeting, and I just shared with them the concerns that had been elevated to me from the county emergency managers, and then also just, our thoughts here from the district regarding the response to COVID-19 across the state, and particularly our region, and how it connects with the state. I think it was a overall good conversation. I was appreciative that they were responsive to our concerns and interested in trying to make some improvements that might assist us at the local level. And they did commit to following up with me after they had some internal conversations, and unfortunately they haven't had those conversations, haven't, I guess, finalized enough to be able to share those with me. So you'll probably see this on the agenda for next month. Hopefully I'll have a little bit more information. And I'll pause there. I have a little bit that's related to that with the executive committee meeting that I was also asked about, but I'll hold that for later in the agenda. Thank you.
Okay, thank you. All right, introduction of new employees.
Okay, I think, I just saw Jamie. Okay, Jamie and I guess Josh, and I think Doug is remote today, or someone might be introducing for him, I'm not sure. So.
Good morning. Can you hear me, Ashley?
Yes, we can hear you clearly.
Okay. So I just have one new employee to introduce. We've been having a competition, and I've been getting my rear kicked apparently, but just one today, but an awesome one. So this is Marissa Hipsch, and she's one of our new nurses in our Nurse Family Partners program. So I'll let her say just a little bit about herself.
Hi, I'm glad to be here. I came as a labor nurse, so that is my background. And so I'm excited to get the opportunity to educate our moms in our county and kind of be their resource in their guidebook and show them all the great community resources we have for them and their kiddos. So, thanks.
Okay, thank you. Welcome.
Good morning. I'm Jamie Annenson, Division Administrator. I have 4 to introduce today. So I'm going to start with Chris Avavon. Chris joins us as an Environmental Health Specialist 1.
Hello. Yes, I graduated about 2 years ago. Just got hired on earlier this month, and I'm excited to learn about IDAPA and DEQ.
Welcome. Thanks. Next up, I have Maria Panatopoulos. She's an Administrative Assistant 2.
Hello, yes, I'm Maria Panatopoulos, and I come from the state as a Technical Records Specialist 2, and I'm here to help support the division.
Welcome. Very good. Thank you. Next up, I have Daniel Adams. He's a Senior Health Education Specialist.
Good morning. I'm a Health Education Specialist Senior, so I'll be coordinating the Idaho Physical Activity and Nutrition Program, which includes Fall Proof and the Diabetes, Heart Disease, and Stroke Prevention Programs. And happy to be here. I've had a chance to get out into the community and really enjoyed doing that. So thank you.
Thank you.
Thank you. Welcome.
And Jessica Hansen. She's a Health Education Specialist.
Thanks for hiring me on. This is awesome. Yeah, so I am going to be working for COVID contacting, and I'm very excited to be working with this team. I don't know if you can hear me, but thank you so much. Thank you.
Welcome. Thank you. Doug, your turn.
Good morning. I am remote, and can everyone hear me?
Yeah.
Yeah.
Yes.
Okay. Thank you, Commissioners. I'd like to introduce David Adams. David is our new IT support senior technician, replacing an opening that we've had vacant for about 4 months, I think now. We've been looking for the right fit, and we finally found that. So I'll turn it over to David to explain, I guess, who he is, and appreciate the opportunity to introduce him to all of you.
Yes, I'm David, and I'm joining the IT team. I recently spent 2 years as an intern in the IT department for the Idaho Transportation Department, and I'm really looking forward to moving to this spot and help everyone out here.
Thank you. Welcome. Okay, that's it then. Well, welcome everybody. As the new hires, we appreciate what you do and looking forward to working with you. And just on a personal note, good IT people are hard to find. So welcome, everyone. All right. The October 2021 Expenditure Revenue Report, we'll turn that over to Troy.
Hey, good morning, everyone, commissioners, Commissioner Elliott. If you will turn to your expenditure report in the packet, you'll see the expenditure reports for October. So for October, we should be about 33.33% through the fiscal year. Obviously, that's through October. And then you can see in our year-to-date, sorry, I don't know why I'm struggling here this morning. Sorry, I'll get it together. You can see in our income statement information, our year-to-date revenues over expenditures, we're still in the positive by $338,000. But for this month alone, we kind of stayed really close to revenues over expenditures. We're down just a little bit, which is not a bad place to be in. We've kind of stayed really close to breaking even, which is kind of where we want to be. Then if you look down just below, you can see in our revenue section, we have our, you can see the different percentages as they come in for county contributions, for fees and contracts. So currently our fees are right on target, just, I mean, hit right on the nose where we should be. County contributions are down just a little, and that is not based on anything other than the time frame for House Bill 316 to kick in March. So that will change as that comes into play. And then our contracts are actually billed at a little higher than we are on that 33.3%. And that's just based on work that's done in the early part of the year. So our overall percentage in revenues is 32.9. So we're almost right on target with our revenue forecast. Just down below that, you'll see our expenditures. And you can see that we're pretty close there as well. Personnel is staying pretty close. We're at 31%, operating is at 29%. So our overall expenditure is at 29.9%. And we are only at 4% in capital outlay. We haven't expended anything yet in trustee and benefits. Some of those subgrants are still being worked on, and we're still anticipating that amount that's in the budget there. As we do our budget revision, we may adjust some of those numbers as we know more about how those subgrants are going out the door. So then that is kind of the overview. And you can see across in each of those different sections where those revenues and expenditures come and go in each of those columns. Does anybody have any questions so far? All right, I'll move on. The next page, you'll see a graph for your year-to-date revenues. And you can see we're pretty static with where we've kind of been. And you can see for July, and August, and then September. The August and September in the contracts, you can see that there was quite a dip. That August area, kind of just as a reminder, was when we were still working on our indirects rate. So we didn't bill as much, and a lot of that kind of came in late. So most of that fell into September. So you can see that's why on that graph, the contracts for fiscal year 22 are really high. But when you look in October, they're really on par with fiscal year 21 in comparison, and then fees are up just a little bit across the district from fiscal year 21 to 22. On the next page, you'll see the expenditures, and again, the comparison to fiscal year 21 and 22. So when we look at October, we're really close to where we were last year. With regards to how our expenditures are working in operating. Personnel is up just a little bit from last year. And then capital outlay, again, we've not had any capital outlay until October when we had a little bit of spending that were some of those committed funds that the board approved for fiscal year 22. And again, no spending yet in trustee and benefits. And then the last graph is again our yield for our investments. So you can see that's really starting to kind of, hasn't started ticking up yet, but it is definitely kind of leveling off. We're getting really close to kind of that zero. So I'm hoping as time goes on that starts ticking back upwards, but it's hard to know those things. Those are driven by the market. So hopefully that will stabilize and start heading in the right direction. Does anybody have any questions on the graphs?
Guess not. Keep going on.
Keep going. All righty. So the next page is really kind of our summary of restricted and committed funds. So you can see as an example, we have where we have listed in our restricted funds or the Behavioral Health Board, parents as teachers. Now that money actually is a lot more than you saw last time. We did receive our fiscal year 2022 monies that came in from the state. So that is why that number jumped up quite a bit. So those are restricted and spent for those come in advance and are restricted. The Citizens Review Panel, the Kresge grant, the COVID incentive grant is, again, those monies that have to be out, they have to be spent by March 1st, out the door. And then the Crisis Center, CFAC monies are still there. The committed funds on the right column are those committed projects that we reached out to you in early budget development to set those monies aside. So some of those projects are progressing. At this point, we still have a couple projects that are committed that haven't been, we've actually gotten a purchase order. So like as an example, the EH vehicle has been ordered, but we haven't actually paid for it yet. So that's why that number is still high. And some of these other projects are still in the works. And so those numbers are still there. So that is the remaining balance as of October 31st of the committed funds unreserved. Any questions there? All right. Well, hearing no questions, I think I'm next on the agenda for the Zweigart John and Associates financial. So I believe in your packet, the next page should be the engagement letter from Zweigart John. So our intent with this request was really about looking at how our financials are put together. We have been using Eide Bailey to put those financial reports together. We've had they've done a moderately okay job on them. I've had to go back and make some corrections and changes, particularly on the CFA, the Schedule of Expenditures for Federal Assistance. That's required for every fiscal year on top of our financial reports. And so that one, they provided the CFA financial report, but it was in such bad shape I had to redo it. So Eide Bailey has generally done a really good job. However, when I chatted with our auditor, I asked him about what that looks like, who's good to use, and I did do some research with regards to GASB and GAAP and GAGAS, which are the governing bodies for auditing of federal funds and grant funds. And there is a stipulation inside of GAAP, particularly that the generally accepted accounting principles that allow for auditors, if we can provide mitigating controls, an agency. So essentially, financial report preparation is what they call a non-attest service. And all of the guidances, the GAGAS and the GASB and the GAAP, all provide a stipulation to allow financial reports to be created inside of an auditing agency if there's mitigating controls that can prevent. So I reached out to Jordan Zweigart, who is our auditor, and asked him this question. And then I also reached out to April Renfro in the state legislative office, and I haven't heard, she hasn't responded back, and I don't anticipate that she will. But based on my conversations with the auditor, he believes his agency can continue to maintain independence, which is the requirement. He has to maintain independence, and he has to stipulate that if he does this work, that he can continue to maintain independence. And so this request is about really kind of setting those mitigating factors in place. And so if you look at the engagement letter about 2/3 the way through, you can see his statement where he talks about, where did it go? There was a statement in here where he mentions that they can continue to provide independence. Yeah, so I think it's at the last part of the first paragraph. In regards, where he talks about their independence with their audit, and he believes that they can do that. And I also have written emails from him where he tests that they can maintain independence. They actually have a separate part of their agency that does this. And essentially, the benefit that we get out of doing this, although it's going to be very separate from the audit, and Jordan won't be involved in any of that, they actually provide an internal review on their end, where Eide Bailey did not. The other struggle we had with Eide Bailey is they wanted to raise our rates and not do as much work. So that was originally what kind of cued the conversation. So when I talked with Jordan, he said they actually have a separate agency that's not at all connected, and that's kind of the requirement. That non-attest service has to be completely disconnected from the audit function. And so he said they have an internal review, and then really the prime responsibility lands on us as a district to identify that we will monitor, we really take control, which is really our process anyway. Our process requires that I review it, I have somebody here in the office review it, and then it goes out to the other health districts to review as well. So we have, I believe, strong enough controls to allow this to happen, but it was something that I wanted to make sure that we brought before you. When I chatted with Nikki, she wanted to make sure that you all were in on this. And so when we talked with him, we actually had him address this directly to you.
Okay. Does anyone have any questions or concerns with that?
This is Chairman, or not, sorry, other job, Commissioner Smith. I'm concerned in general. I don't know enough about it, but I think that it's easy for a company to say that they'll keep it separate, but the role of auditing, I think, should be very different from the people doing the work. And even if they have different departments, they still report to the same leader. And so I personally would have trouble with that. I appreciate the relationship that Troy has with them, but if Ide Bailey's not doing a good job, I'd like to know that they were informed of that, but then also maybe we go out for an RFP and seek new pricing and put it out there instead of just going all with one company. And I don't know that I just would be concerned with the perception of that checks and balance system within one company, personally.
Okay, thank you for that. Any other thoughts on that? Agree with?
I agree with Carrie.
Okay. Anyone else have concerns or thoughts? Okay. Where do we go from there?
I would propose that we move forward with an RFP seeking the services that Troy needs, with new prices being given, and put it out for other organizations to respond to.
Okay. Do we have any other thoughts on that direction? Kelly?
This is Troy.
I would support that.
I'd like to offer a little bit more information as well, if I could. So this particular, the amount of money that we pay for this service wouldn't actually require an RFP, but we could definitely go out to bid, and that's what we did when we first established these. We went out to bid and we selected a few, once we got their bids and we reviewed them, and they had definitely fallen under the level even for an RFQ. So we didn't need to even do an RFQ. We could definitely reach out to others and see if there was others interested. I kind of take your point to contacting Ide Bailey. I have chatted with them on a couple occasions to let them know that we did have some struggles. They actually pulled completely out of doing the CFA, that once they had presented the CFA, it was in such bad shape. I told them that I was just going to have to do it myself. So not only did we pay them to do that service, we also paid for my time to redo it. So that was my concern initially with them, and I don't have any problems continuing to do the CFA. I was just concerned they raised the rate on top of that to also then not do the CFA. So I'm super happy to reach out to Ide Bailey, see if they're willing to reduce the rate or what his thought was on that. And then if they're not going to budge or we want to choose to go to someone else, then it definitely would fall under the fall below that threshold for both an RFQ or an RFP, but we could just put it out to bid like we did initially.
We could move forward with going out for bid. I feel like that's not too much of an extra step for us. And
yeah. We can decide to do an RFP even though it's under the threshold. We can do that just because that's the right thing to do. So I don't have any qualms with us going out and looking at other entities and seeing what we can come up with. Thank you.
All right, we can go that direction. What did I understand correctly that you thought that the services provided by Ide Bailey just didn't meet what they were really obligated to do?
Primarily, yes. Like I said, it was really more about the SEPA, their financial reports. I had to do a little bit of tweaking with it in the end, but Bailey actually did a really good job with the prime financial reports. It was really the SEPA that was really kind of in bad shape. And that was really what started the conversation with Jordan. And again, that was what kind of facilitated him presenting this engagement letter.
Okay, thank you.
Yeah.
We don't need any action. We'll just move forward.
Okay, move forward with an RFP then. All right, very good. I guess that's the direction that we'll head. Then we'll wait to hear from you.
Okay, Commissioner, just so I can get clarification, so you want an actual official RFP?
Go ahead.
This is Commissioner Smith. I like that, Troy, because then you can clearly define what your needs are. And, I mean, I guess you can also do that in the bids, but I agree with Commissioner Aberstary that it doesn't limit us. The RFP process, I do think, for transparency is really great, and it gives us opportunity to seek.
Okay. We're in agreement
bigger
on
range.
that then, that direction? Okay. All right, please head that direction then.
Sounds great. I just want to make sure that I will let you know a time frame. Typically, RFPs, particularly through the state system, can be a 6-month process. So our audit was originally scheduled for April, which means our financials needed to be done by March. So I'm super happy to do. There's no emergency situation that means that our audit needs to be done by April. Just as if we cross that into the following fiscal year, that they're going to be 2 years behind in our audit. I'm super supportive. I think that's not an issue. I just wanted to make sure all we're aware of the timeline that might come into play with as it relates to our audit.
Right. Yeah. All right.
Good. Thank you very much for your time and consideration. I appreciate it.
Okay. Well, thank you. We appreciate it.
Absolutely.
Okay. Rachel is up, I guess, with the VEERS.
Hello. All right. Are you all seeing my presentation here? Not the presentator view.
Yeah.
Yes.
I think so.
Okay.
And you too.
I am hearing a little bit of feedback, I think, from the main room.
Cool.
Rachel, you want to try talking now to see if it's better?
Yes. Yes, that's better. Thank you. All right. Well, so today we are going to talk about the VAERS system, the Vaccine Adverse Event Reporting System. I'm sure we're all very familiar with this database. It is managed by the CDC. And today we're going to talk about the purposes, uses, limitations, and some of the findings from this database. So first with the purpose and appropriate uses. So the purpose of VAERS is to monitor the safety of vaccines after they're authorized or licensed by the FDA. And I think that's a pretty important topic here, is that these are not experimental trials. These have already gone through clinical trials, and these are data on vaccines in the real world. So we're looking at the assessing the safety of newly licensed vaccines, detecting unusual or rare adverse events that happen after vaccination, monitor increases in known side effects, things like sore arms or anaphylaxis, identify potential risk factors for types of health problems related to the vaccines. So determining if a particular issue is more common in women or men or elderly or young people, and identifying possible reporting clusters. So that would be related to things like our lot numbers, and if there might be a facility that's not following the instructions exactly, and we might have issues from that. So that's what that means by reporting clusters. And then on the second bullet point, I have a quote from the VAERS website. So when you go to VAERS to either report data or pull data, and look at any of the VAERS reports, you do have to review just a few paragraphs of information and say, yes, I've read this and accept this. And a part of that is VAERS is not designed to determine if a vaccine caused or contributed to an adverse event. A report to VAERS does not mean the vaccine caused the event. And we'll get into this a bit more on the next slide. So we're next going to talk about limitations. So the limitations of the reports that we see in VAERS and their usefulness in statistics. So first, VAERS reports are submitted by anyone and can sometimes lack details or contain errors. So oftentimes we will have, this can be submitted by a doctor, it can be submitted by yourself personally, family, friends, cousins, sisters, nurses, really anybody can submit a report to VAERS. So if somebody, has an event happen and their doctor submits a report, they submit a report, their sibling submits a report, we might have duplicated reports, we might have lacking details when non-medical providers are submitting these reports. So there's some possibilities for errors. And the next, medical providers are required by law to report certain events and any deaths that occur post-vaccination, regardless of the cause of death. So there's a list of different disorders or conditions or events that might happen post-vaccination for each different vaccine, as well as any death that occurs post-vaccination, regardless of the cause of death, is required by law to be reported to VAERS. So that, I think, can hopefully ease a few people's minds when we think of what we see in the VAERS reporting system. A lot of that is required by law to be reported. And VAERS data alone cannot determine if a vaccine caused the reported adverse event. VAERS accepts all reports of adverse events following vaccination without judging whether the vaccine caused the event. And reported events must be compared to the expected frequency of said event in the general public. That's called the background rate. I will get into that a little bit more on future slides, but basically, Dr. Summers mentioned this earlier in the discussion. If we have a group of 1 million people and we see an event happening at a certain rate, we would expect to see that event happening at the same rate amongst a group of vaccinated people. So next we're going to talk about correlation versus causation. I'm sure we've all heard the saying, correlation does not imply causation. So correlation is a statistical association between two variables. So if one variable increases, the other will also increase, or vice versa, decrease, and the other decreases as well. Causation is a change in one variable that causes a change in another variable, basically taking correlation a step further and proving that one is causing the other. So kind of a silly example, but I think it highlights the point. Ice cream sales and rates of drowning are correlated. Does that mean that ice cream causes people to drown, or that drowning causes people to buy ice cream? No. Instead, there's a third variable, warm, sunny weather, that influences both variables separately. So when we see nice, warm, sunny days, we have people buying ice cream. We have more people swimming, which means we might have more drowning individuals. So there's a third variable influencing both of those. They're not correlated, or they are correlated, but there's no causation. So next, we're going to look at a few different scenarios pertaining to VAERS. None of these numbers or data are representative of anything. They're just scenarios. So in this first scenario, we have VAERS reports 10 cases of vaccine-induced allergic reaction. And the question is, what is the denominator? So the numerator is the 10 reported adverse events. The allergic reaction, the denominator would be the total number of people who received the vaccine. So if there were only 20 people that received the vaccine, that's about 50% of people are experiencing an allergic reaction. That's not good at all. If there were 10 million people that received the vaccine, still a very rare event, about 1 in a million. So the denominator is the total number of people vaccinated, and it is very important for interpreting the rate of adverse events. All right, so we have another scenario here. So this is going to discuss the background rate, which I mentioned a few slides ago. So in this scenario, VAERS reports 10 cases of blood clots out of 10 million vaccinated people. If we look at a random sample of 10 million people that were not vaccinated, how many have blood clots? So that would be the background rate. And if the event happens as frequently in the background rate, we can tell that those blood clots are not caused by the vaccine and are instead just something we would expect to see out of a sample of people that size. And so I'll look over here at this graph. This is from a WHO vaccine efficacy training. The graph is not representative of any actual data, but we can see in the green, that's the background rate. It's either collected prior to or simultaneous to the vaccine administration. And that is basically just looking at health outcomes and events that happen in the general public. And then in the yellow section here, we have the known expected reactions. So as I mentioned, VAERS is for approved and authorized vaccines. So we've already undergone clinical trials and we already know that there might be some risks associated, and those are expected. So things like anaphylaxis or ARMS, whatever the event or reaction is, there is an expected and known range there that is included in that initial authorization. And then when we get up to this red slice, that is where we really start to see action being taken. That is where we see excess vaccine reaction rate. So that's more than the background rate, more than we expected from our clinical trials. That's where we would really, pause a vaccine or the administration of a vaccine and take a deeper look at the data. And then I have one last point here on this slide. If we looked at a random sample of 10 million people who had the disease but no vaccine, how many of those would have blood clots? So really we want to look at 3 different factors: the rate of the vaccinated group, the rate of our control group, the unvaccinated, non-diseased group, and the rate of the group that has the disease, and compare rates between those 3 groups. So next we're going to look at identified risks. So these are times when we have used VAERS data and found either issues or looked deeper into vaccines and the reactions. So first we'll talk about the Jansen COVID-19 vaccine. Again, I'm sure we're all familiar with this. In April of 2021, in total, there were 15 cases of a rare and severe type of blood clot reported to VAERS. And at the time, there were 8 million doses. As Dr. Summers mentioned earlier, there were 6 cases out of 6 million doses initially when it was paused. This data comes from the risk-benefit analysis. So this was after they paused the vaccine and had waited a few weeks to collect all of the data they could on this issue. And the administration of the COVID-19 Jansen COVID-19 vaccine was immediately paused and the data was reviewed. It was determined that the benefits of receiving the vaccine outweighed the potential risks. Here on the right, I have a graph from a hundreds of pages worth of risk-benefit analysis from ACIP. And so this is just one part of that. There's obviously a lot more nuance to this discussion, but I thought this was pretty interesting and kind of highlighted that risk-benefit analysis. So for every 1 million doses of the Jansen COVID-19 vaccine administered to females 18 to 49, we expected to see 7 cases of TTS and estimated a prevention of 6 deaths, 56 ICU admissions, and nearly 300 hospitalizations. So while that also influences, that's personal, savings and things if you're hospitalized, but also protecting our hospital resources and people who are dying from excess deaths because they might not have access to hospitalizations or to hospital care. So that's just a little highlight of the sort of risk-benefit analysis that would be looked at. And then this is from a publication that it was a study conducted on VAERS safety data from December 2020 through June 2021. They looked at the mRNA vaccines in the United States. Nearly 300 million doses were given. And the most commonly reported side effects were injection site pain, fatigue, and headaches. And during this time, there were about 4,500 deaths reported to VAERS in people who received mRNA COVID-19 vaccine. If you remember from the previous slide, all deaths are legally required to be submitted to VAERS post-vaccination. So any death from any cause needs to be reported. And compared to the expected background rate, so an equally sized group that was not vaccinated, they looked at deaths from all causes in that group and compared it to the 300 million mRNA vaccines administered. And they found that following mRNA vaccination, consistently 15 to 30 times less frequent. Death was consistently 15 to 30 times less frequent within 7 days of vaccination, and 50 times less frequent within 42 days of vaccination by age. So what are some takeaways from this? First is VAERS is a very useful and sensitive database. As we saw with the Jansen vaccine, it was a 1 in a million occurrence, and we were able to identify that and pause the administration of that vaccine. But there's no claim of causation for events reported to the system. The background rate of an event is essential to interpreting VAERS data. As I mentioned, a lot of things are required to be submitted. And so if we don't know the background rate of that happening, then we don't really know what that data is telling us. VAERS reports are being monitored very closely, and public safety is the first priority. And out of all of this, the COVID-19 vaccines are extraordinarily safe and effective. We have hundreds to thousands of people across the country monitoring this every day, keeping public safety in mind as the first priority. And then I have references here. This last one is the risk-benefit analysis for the Janssen vaccine, if you are interested. And this one here is the publication that I referenced. Do we have any questions?
So of the deaths, I know it says on the WHO report that deaths are not, death must not be considered an adverse reaction. I guess that's kind of a bizarre statement. So are you aware of the autopsies from the deaths that have from the vaccine? Are there, you said they must, according to law, they must be reported. So have we seen any autopsies? Has there been studies done on that, or are there any autopsies being done at all?
I am not sure about autopsies. I know that there are death reports, and those are submitted with the VAERS reports.
So when you look at the vaccine insert, all it has on it is a UPC code, or whatever you want to call that code. It doesn't have any of the actual side effects, possible side effects, because with any medication, any pharmaceutical, there is pages of side effects that are possible, not possible, rare events, whatever you want to call them. They are included in that, and in the vaccine insert, there is just simply the code that you would have to be able to use your phone or whatever and go to that code and see all that. I don't even know if it's on there because I've never seen anything but this huge giant piece of tissue paper with a little teeny tiny code on it. Have you seen that?
I have not. When I received my COVID-19 vaccine, I did get, I think, probably 5 to 10 pages worth of information on the vaccine, resources that I could go to online, but there was explanation of the side effects or potential risks.
More than a code, okay. And so
Yeah.
Are all the parents aware of this when they want to give this to their kids? They are given this in advance to look at, like with the permission form?
I am not sure.
I'd appreciate it if you look in that. You did. This is a great presentation. It's just that it would have been better if you had just focused on Idaho and broken down, which I have a breakdown here of all of the side effects, and these are just most of these are actually reported by doctors' offices that I have anyway. So
the reason that I didn't do any analysis specific to our state is that I didn't have access to the background rates. So I didn't know how common, how many deaths we had for all causes. I didn't know how common some of these side effects were in the general public. And as I mentioned, that is, really what we're looking at when we're looking at VAERS data is how does it compare to the background rate? And since I didn't have access to those, I didn't do any specific local analysis.
This is Summers, and I think the important thing and the reason to go nationally is you already made the comment about denominator. And 1.8 million in Idaho and 350 million in the country. The number's a whole lot more accurate.
That's a great point, Dr. Summers. Yeah. Are there any other questions?
Anything else? Guess not. Thank you very much for your presentation and the information.
Thank you all.
Thank you.
Okay.
You know,
yeah, go ahead.
Commissioner Purdy, I don't think, with the VAERS, I'd be surprised, frankly, if there were very, very many autopsies. I mean, I don't know, but I would be very surprised about that.
Yeah, I would, as a commissioner, I would doubt it too, because we get the bill for all the autopsies in the county, and it's substantial. So, and there's not very many places that will actually do that. You know, they have a very limited capacity in this area for that. So, at least that's my understanding.
Yeah, I'm sure you're right about that. I mean, there isn't even any autopsies of COVID deaths that I'm aware of in Idaho, probably. But this is sort of a national. She was taking a look at on the national level, and it would seem like it would behoove us to have some autopsy results from some of this stuff, so you could actually see what was going on.
Yeah, I guess we got to figure out somebody to pay for them. So.
There's certainly plenty of money to pay for a vaccine.
Well, I'm saying the family is impacted by a death probably most of the time is just not going to come up and want to spend that dollars. So, anyway, understand what you're saying, but I see that as being a hurdle to try to get that information. Okay, is there anything else on this topic? If not, let's take a quick break. We'll do 10 minutes, no more. We'll hurry up. Those of you that wish to have discussion, please do it outside this meeting. Okay, okay, are we ready to get going then? Let's jump back into our agenda. Western Idaho Community Crisis Center Quarterly Update. So we'll turn the time to you, Sam.
Hey, good morning, everyone. I'm just going to review our quarterly update. Our second quarter ended at the end of September, so we got all our reports in, and I wanted to make sure you were aware of some of the data. We're going to go over some of the regular data points. And Ashley, do you mind pulling up the, thank you, she's on it. And then we'll discuss some of the projects that we've been working around the Crisis Center. So, first slide, Ashley. There we go. These are our data around our census through the summer months. You can see that we trended downward in our census. And that seems to be a normal trend, especially with those that are accessing the Crisis Center due to housing. They can sleep in their car during the summer or find another warmer place to habitat other than the Crisis Center. So that's a typical trend in the summer, but the Crisis Center continued to spread the word about the services, and we worked hard on making our partners at our jails and our hospitals aware of our services. Next slide, please. Again, this is the layout of our counties that are accessing. We had an average daily census of 4, which was down quite a bit from in the heat of COVID or the cold of the winter, whatever you want to call it. And the average stay was only about 15 hours, so a little bit more efficient than prior quarters. 78% of those accessing the crisis center were from Canyon County. We saw people from counties as far as Bonneville County, Idaho County. We continue to see a small amount from Gem and Payette, Owyhee, and Washington County, and as well as a few coming in from Oregon just because it's a closer crisis center. Next slide, please. This data point kind of shows us the gender and also the age groups. Again, the men's shelter was closed during this period in Canyon County, but with the lower census and men likely living in their own cars and vehicles, which we've heard reported a lot actually, we did kind of even out our census from last quarter to see more of a natural ratio of men to women. And then over the last 2 quarters, we've seen quite a consistent increase of the ages 25 to 34 being at a higher level than all of last year. So that's a trend that I kind of want to keep an eye on, see if there's anything happening in that age group, or if we can tailor our messaging and marketing to help those individuals find preventive services. Next slide, please. Again, combined diagnosis of mental health and substance use disorder remains the top diagnosis at the crisis center of those actually accessing. People come to the crisis center in crisis for a number of different things, but the actual diagnosis is what the clinicians there determine. But they present with their own concerns, and this time it was the first time that housing was not the #1 concern, but sobriety was. So they're pretty neck and neck, really, but again, those are the reasons people are accessing the crisis center. Next slide, please, Ashley. This insurance, oh yeah, go ahead and have a question. If you have a question, any point, just.
So on the sobriety one, I wonder if that's like going back to the words correlation with the COVID pandemic and putting people in their homes. We saw an increase in alcohol that was significant on cells, and so now we're trying we're trying to get people back into the workforce and back with their feet underneath of them, and they're recognizing it was a bad year.
Yeah, that's a very interesting idea of correlation. Maybe not causation, but there's something to that.
Anyway, sorry.
No, I appreciate that, Commissioner Smith. I think it's something to keep an eye on. Again, with marketing and messaging, where can we market around what crisis center services are available, and where can we be preventative? Okay, so this next slide again, insurance and reimbursement for services at the crisis center are what help sustain us. You can see that just under half of those that are accessing the crisis center are insured through Medicaid or Optum. We did fail an Optum audit. I want to be transparent with all of you that we failed an Optum audit at the crisis center due to readmittance earlier this year, and that's definitely around the system being broken with the men's shelter being gone. So we're working to meet the conditions of our corrective action plan with Optum. We meet regularly with them, and we continue to see issues around remittance, but we're doing our best to fix those problems, and I'll talk about some of the things that we're doing as a committee and to support this system's impact on our crisis center a little bit later in my presentation. The site director, like I said, meets regularly with Optum and is working to connect to resources on housing in the community. Next slide. So our referral sources, a lot of people are self-admitting, but we continue to get referral sources from our friends at the hospital and through jail systems, parole and probation, law enforcement, and they continue to be steady and consistent. Our diversions are a little bit down, and I think that's just from overall census. They're down from the hospital in particular, so I think people are just avoiding the hospitals with the surge in COVID from July, August, and September. And then the overall cost savings are down. But the jails
over the last quarter, had a little bit more diversion. They almost doubled their diversion costs savings this last quarter, so that's good to be developing those relationships. Next slide, please. This just shows where we refer and what needs are we meeting with community partners for the individuals that access the crisis center. Again, food supports, housing supports, substance use supports, anything that they can access. When they leave, we try to connect them to things that can help them with their journey past the crisis center. We also have referred partners to higher level of cares in hospitals and other intervention hospitals, St. Luke's, West Valley. And Allenbaugh House is actually in Ada County, but it's a detox center, so that makes a lot of sense. But I think that's the first time it's showed up on one of our diversion report or referral reports. So I wanted to make sure you understood that. Next slide. And any questions so far? So our after crisis follow-up, the site director, Caroline, has implemented a new process where she's having staff call those that left the center about 30 days after to answer a few questions and get some information on how they're doing. And 80% of those reported a higher quality of life 30 days, of those that answered the phone and actually she talked with, life was a little bit better for them 30 days after the crisis center. And 50% of them followed their care plan all the way through. So that's some good feedback that I don't think we've had before, which is really nice to know about. And then the average customer experience score dipped down a tiny bit over the summer, just about a half a point. So it's 3.2423 out of 4. And again, great feedback from those that are accessing the crisis center as far as the life-saving interventions that they're doing there, which is always lovely to hear. Next slide, Ashley. So the housing supports. As I mentioned earlier, we were having some issues with readmittance. We didn't have a shelter here. We, as a committee, Kelly can attest, got a small work group together to kind of start addressing some of these systems changes, systems problems that impact the crisis center. And we started attending some regional housing authority coalition meetings and talking to people in housing that are trying to find solutions. And they came together and wanted to write a letter to Lighthouse, the shelter in Nampa, and ask about the services. We had Reverend Roscoe come to our committee meeting in July, and he said he was going to close the shelter. But with enough people signing on to this letter, he opened the shelter this month for 15 beds, which is a huge thing for our area. Even though it's just a small amount of beds, we hope that it gets inundated and he sees the actual need that we have here. Which brings me to the next housing support that we learned of recently that is coming out of not just our crisis center, but crisis centers across the state that are feeling the impacts of the housing crisis and seeing it in the crisis centers. So Janus is a nonprofit organization, and they have an Empower Idaho unit that tries to help with people getting back on their feet. And they're doing a pilot with crisis centers in 2022 to provide some funds to help individuals accessing crisis centers get a down payment for rent, find temporary housing in a hotel until they can find a sober living shelter. There's all these waiting periods, right? So they're trying to fix that little interim gap that we have with this small pilot. And they're dividing the funds to the different crisis centers based on the point in time counts for homelessness that the state does every year. And I don't know if the Board of Health, if you're all aware of Region 3 making up 48% of the homeless point in time count for the entire state. So we'll likely get 48% of those funds for our crisis centers in addressing housing, which is awesome. And we look forward to working with Janus and Empower Idaho to help these people
stable housing and stabilized so that they can actually start addressing their mental health needs and their sobriety needs. We do have a few updates that we needed to do for this facility that we're working on, moving some security cameras to for better placement and better visibility, and as well as there's carpet in the front entry. I don't know if any of you have been able to tour, but after 2 years of having carpet in the front entry and people coming in to get sober, there's quite a lot of mess and stains on the carpet, so we're looking at a different option with the facility there, and which will be nice, so they don't have to worry about that. And then it's also next on the agenda, but I have it here in my slides. No, but we talked about Habitat for Humanity or working with someone with like Elevate Academy.
Elevate's awesome, but Home Depot does donate to nonprofits consistently with just product, and
that would be awesome.
If you got that product donated, then the Elevate kids could come and install it maybe, and the Elevate kits are awesome.
Yeah,
I love that you're using them.
Yeah, we were talking about those options for sure, so thank you for bringing that up. So does anyone have any questions on the Crisis Center quarterly report?
Summers, I have just one question. Presenting concern, 7% were suicidal, but on community resource referrals, it was the highest hotline. The hotline was the highest at 389. There's
The
kind of a
hotline,
disconnect.
yeah, the hotline offers a lot of services beyond just crisis call services. They will call and check in on sobriety. They can be there for if they're having any kind of issue. So I think they promoted that as a referral source for anyone to call as a preventive measure rather than readmitting. So that to me makes sense. Any other questions? Okay. Next on the agenda, if you don't mind, keep going, is Youth Behavioral Health Update. So next slide, Ashley. In August, I just want to remind you that we had Rachel do another amazing presentation where she leveraged data from a lot of our partnering agencies, hospitals, law enforcement, local agencies, and the Crisis Center. She presented that material to you back in August about where we are with youth especially needing support and families needing support at this time in COVID. So in the meantime, we've been looking at the landscape of what's here and what's available, what resources do we have for families and youth regarding crisis services and mental health and behavioral health interventions. And so we have been working in the last couple of months to understand that and have gathered a group of stakeholders together last week that included some of our local hospital systems, our county juvenile justice, some family advocates, local schools and universities, nonprofits, and behavioral health professionals to talk about the material that we gathered and to just truth test with them, is this what they're seeing? And they agreed that there are a lot of gaps in services for families. They're seeing elevated need for services for youth especially, and they expressed a desire to find solutions together, knowing that all of our resources are better utilized in tandem and concert together than individually. So they wanted to make sure that we pursue youth voice in any solution that we're doing. So the next steps for us out of this conversation is to try to access some youth. So we're meeting with youth councils of mayor's offices in Nampa and Caldwell in the coming weeks. We're also working with some of the schools that volunteered to help us with possibly surveying students and accessing some students that might have needed or utilized crisis services in the past, and trying to design a solution that fits our community. Nikki, do you have anything you want to add to that, or do you all have any questions?
Are you working with churches as well, and from from your standpoint as being on a behavioral health board, I guess I just wonder, are you getting so many different committees or services or whatever that none of them are really combined and just turns out to be a big spread out mess and nothing ever really gets done, which is kind of what government agencies are famous for?
What we're seeing is a lot of people trying to put on Band-Aids and not really working together at an actual solution that's in concert. So we're trying to bring those stakeholders together and initiate those conversations. Again, this was the first conversation that we've had, and we intend to bring those stakeholders back and add to those that stakeholder group in January to make sure that we're understanding the landscape and trying to move forward together.
And some of the churches?
Yeah, if you have some good names, that'd be great. We are not adverse to working with churches or social groups within the communities.
Thank you. Okay. I guess next on the agenda is our trustee and executive council update. So I'll turn that time over to Georgia and Nikki. Okay.
We're just deferring to me. So the trustee and executive committee met, and there's really not a lot, so this will be brief, but one of the big, one of the larger agenda items was the trustees voted to change the funding formula for the home visiting state appropriated dollars that currently go to the state and then are passed through to the public health districts. And that's something the public health directors had been working on. There'd been a reduction in funding, I think, in the last legislative session, and then also the original appropriation was determined kind of quickly and during a time when there was discussion at the legislature about Medicaid and Medicaid expansion. So there were some different ideas about how to determine how best to distribute the funding, and what was decided at the time was to base the funding distribution across the 7 districts on how much home visiting funding you received through the federal subgrants for home visiting. And our district, in District 1, which is up north in Idaho, North Idaho, received quite a significant more funds because we have a more expensive program that supports our region based on need. So that then some of the districts that were already receiving less received even less to expand their home visiting programs. So I think we all recognize that wasn't very equitable when you look at the needs across the entire state. So the directors made a recommendation to the trustees, and they voted to approve that change in the distribution of funding. So that was one piece that they talked about. And then the only other piece that I wanted to update you on was when we originally talked about the letter that was suggested that I send to the governor about the COVID-19 response. You had asked if I share that information with the other districts and to see if their boards would have interest in doing something similar. Between that discussion and this meeting happening, there was quite a bit of time, so we had back and forth with the state, obviously a few times before the executive committee met, and they appreciated the information. I just gave them an update on the initial correspondence, and I shared those with them, and the response from the state, and then our follow-up letter, and what the board had asked me to do in regard to reaching out to them. And at this time, they didn't express any interest to follow suit and jump on and do something similar, but they were very interested in continuing to be informed on how the conversations go with the state, and that they might at some point want to be more involved. But at this point, I guess they felt like the train kind of left the station, and it'd be kind of weird to jump on it now. So I understand that, but they did appreciate the update and information, and some did express agreement with some of the concerns that we had raised. So that's the end of the update.
Okay. Very good. Next, I guess you're still up for the Opioid Settlement sign-on.
Okay. So there is a presentation in your packet that I'm not going to spend a lot of time on, but I wanted to just let you know. So at the last board meeting, I shared what the settlement agreement looks like for the public health districts. It's probably similar to what the counties and cities received. And we had just received that, I think maybe the day prior or the day following, or the day, I think it was like a day or two prior to the Board of Health meeting, so we hadn't really had a chance to dive into it and digest it. Since then, we felt it would be important, as the board considers whether to sign on for the opioid settlement agreement in terms of health district, that you have some information from us into what we feel are some high priority areas that if we received this funding, how it might be spent. And go ahead and go to the next slide, please, Ashley. And the next slide. Oh, yeah, okay. So I just wanted to throw this. This is, you're not going to really be able to see the graphs on here, and that's okay. It's really just meant to show you a process that we followed. And so what we did is we looked at each section that the opioid settlement agreement covers, with the exception of, I don't remember the exact title of the section, but I think it's really focused on like law enforcement and jails, and that's a little bit outside of our purview. So we didn't look at that area, but in all of the other sections where how the funding is can be spent, we did a brainstorming session on what we currently do, or what our partners are doing, and where there might be opportunities for us to make an impact with this funding if we were to receive it. So we went through each section, identified some of those, and then we prioritized them using an impact and effort model, where we voted on each of the items that we had discussed. So I just picked some of the items that kind of rose to the top in terms of high impact, low effort, and high impact, high effort, for you to be able to read on each of these sections. And I think in just a large part, to summarize, because I don't feel like I need to go through all these right now, I think if we accept these funds, I'd like to hear the board's thoughts on how you would like to direct us moving forward on how these funds get spent. My understanding is the funding could be available as early as January, parts of it, January, and then I think more coming in June and July. So, we don't need to sprint per se out of the starting blocks, but definitely, once the funding's available, I don't want it to just sit there without a plan behind it. So, like I said, we worked through this, identified some areas where we feel like we have opportunity to either carry some of this work forward on our own or in partnership with providers and other community partners. And we're not talking about a lot of money, I feel like, in terms of what's coming to the district. Mike Kane has advised us, we don't know the exact amount yet, but he said each district should be able to fund one FTE, and that doesn't mean we fund one FTE, but that's about the amount of money that he felt like we would be getting with this first settlement. Our understanding is that there's probably going to be other settlements coming. And then he also informed us last week that several of the cities, and I don't know where in the state, but sounds like several of the cities are considering, what's the word I'm looking at, reallocating those funds to the public health districts in their region to manage those funds. And so we can, that's something that we would be able to accept if the board wanted to sign on. I think if we didn't sign on, I guess we could still accept the funds. I don't really know how that would work, or maybe we couldn't because we hadn't signed the agreement. But same with the counties. So we're able to also accept funds from counties if they also choose not to manage those So I will just pause here. I'll maybe just make one more comment. I did talk to Mike Kane earlier this week about who should sign the sign-on agreement if we move forward, and he did advise that that should come from the board chairman, not from the director. So I have those documents here if we choose to move forward with the sign-on. And we would need to make a decision today unless we had a special meeting between now and I think December 3rd is when the deadline is to sign on.
I'd make a motion to have the chairman sign on to the opioid settlement agreement.
Okay, do we need any discussion before this?
I'll second the motion.
Wow, getting railroaded here. We have a motion and a second. All in favor say aye.
Aye.
Aye. I didn't hear enough to even ask for opposed. Okay. Okay, I don't have a problem with that. However, so I guess by that vote, this is what we want to do. Everybody has read and understands what has to be done with this money. Okay.
If,
go ahead,
Chairman. I think probably education prevention, Nikki, would be our first place. I mean, you probably know that already, but if the money's not going to be a lot, maybe that's where we start. It's just educating people on it. This one hits home for me, especially when I spent my time in Northern California in the fire department. We saw this all the time. The abuse of opioids was very frequent. So if you speak to your sheriffs, you speak to law enforcement, EMS, fire, they're going to tell you that this is it's a pretty big deal. So if we can stop the bleeding, use that metaphor of education and prevention, and then we can work on hopefully treatment and recovery as time goes on. I think that'd be good. I mean, you look at what we just got from Sam of the substance abuse with mental health tied together. I mean, that's part of what's going on is this opioid crisis. So.
Yes, Commissioner Purdy.
Well, and we kind of discussed this in our commissioners meeting yesterday, and I think the consensus from us is the time for talking is maybe not finished, but it's already been done. So maybe an actual treatment program. If there's a pot of money put together, how about an actual treatment program for opioids and meth and some of the serious? I mean, we don't have an opioid problem because drugs on the street don't really happen in Adams County. It's pretty cold there, so there aren't really a lot of people on the corners. But the meth is a problem, huge problem. So.
Yes, Doctor. Go ahead.
Summers, I agree. Heroin and opioids are in Adams County. It's everywhere. And my only comment, and I agree, certainly, prevention but ultimately it's got to be treatment. And I guess I would like to see at least this health district and the counties it serves work together. I'd hate to see everybody go different directions, and I think we need to have a coordinated response. And frankly, I think we need to have a coordinated response in the state. I think, we need to be efficient with what we do. I organized medical education for 30 years, and I think this is a state issue, but I think education to the physicians, education to the pharmacists, education to the nurses, police, etc., is a big priority. And the problem right now is the police, the fire department, the ambulance, they see somebody, they give them naloxone, they wake up, they're back out on the street again. And, that is just putting a Band-Aid on it and not fixing the issue.
Okay, thank you. I I agree. It's a whole population problem. I don't know what I don't know if all the counties are going to work together with the health department. I know we had quite a heated discussion yesterday with our sheriff and the hospital and different groups that we were looking at before we decided as a county to sign on, and who is going to administer it. That the administration and the accounting thereof is something that's going to take some dollars. And my direction that I was given was not exactly what I would have liked, but the consensus was that they did not really want to turn the dollars over to the health district, because I guess in the past maybe they've had projects that started out good and then they fade away, and there's no control over where the dollars get put. So I'll just throw that out from Gem County. We wanted to utilize it in county and know exactly where the effort and the dollars were being placed. Yes, sir.
Do you think maybe something, and the time's probably ticking, Nikki, so I apologize, maybe something the health district puts together and presents to the counties of a plan? Because I think you're probably right. I mean, anytime we give up control of that, we're always concerned that maybe it won't be spent in the right ways or right manners. Maybe if the health district puts together some type of plan and then can come to commissioner meetings and to all of us and say this is what we're looking at doing, because by ourselves, what are we going to be able to do with that money? And it's probably very little. Like Commissioner Purdy said, we need to have some type of unified attack on this, because it affects every one of us in this room in our counties. Yeah. And the health district seems to be the best way of doing that. But you're right. Whether it's past scars or trust or whatever, maybe there's bad feelings there.
And I agree with you, Commissioner. That was my direction, my take, but I'm only one of many. And I can see the direction, at least at that point, and that's what I was told and directed to convey. So anyway, anything else?
Is there AA has been around for such a long time, it must be pretty darn successful. So is it not, and I believe it's used for drugs as well. Mm-hmm. Is that not maybe the best program that we could support instead of starting our own? Maybe do something like that. I don't have experience with it, but I've had experience with my family with it, so. NA, okay, yeah.
Yeah, Commissioner Purdy, that's a good question, and I would like to maybe defer to my staff to put together some thoughts and bring it back to the board to react to. And with regard to any city or county funding that we might receive, I think that's also a discussion the board could help inform us of in terms of what your expectations are. We do have the ability to track funding, separately. It costs us more. It's a little bit more arduous to try and say we want to make sure this amount of money goes back into that community. But if that's something that the cities or counties felt really important about or felt strongly about, then I think we could talk about that here and decide if that's something we feel like would be the right direction. So I'll talk with our team and start working on a plan and bring it back to the board for input.
Well, just one more comment. I know that our judge, we've spoken about this. I mean, I think that he would probably be very happy to be able to send people that come before him to, say, NA, a program that's already in existence that has been successful, rather than a health district starting out all brand new.
Yeah, Commissioner Purdy, I appreciate that, and I don't see us starting any kind of, that's just not our area of expertise. So I would see us either partnering with somebody, as you if you went through these slides pretty quickly, there's medication-assisted therapy. We have quite a few providers in our community that have completed that training and certification, but very few that actually use it. And I know some barriers. I'm sure Dr. Summers could speak to the barriers that exist on why that doesn't happen. But I do think there is probably capacity available within our community that we could better leverage, and it wouldn't include, the district necessarily standing that up. I don't really see that happening, rather than working with existing partners.
Yes, go ahead.
I think the struggle in our area, Vicki, is just that we don't tend to have. I think we had one in Weiser for a while. I don't know if it's still there or not, and it was ran through a church religious organization. It's just participation, wanes, and so. But if judges know that this is a program that they could send people to, we might be able to make that program more sustainable. And maybe Adams and Washington go together, or I'm sure Canyon County probably has multiple programs. But smaller counties, we just don't. It's just access to some of it sometimes. Yeah.
Better facilitation.
Yeah.
Yeah, and there's well, I'm sure you've read all the things you can utilize the monies for, and there's like a page and a half of things there, but then 10 pages of how to document it. But yeah, and I think every county is a little different. I know in Gem County we have it's highly used. I don't know how beneficial it is, but we do have a recovery center there that as a county we support. We give them a building to utilize, and I know it's highly used. I just don't know how effective it is, because that's not my area of expertise, or too many of my associates that I know of that utilize it and say anything to me. So I don't know, but I know it is highly used. That is one area that we're thinking about, but there's a lot of areas. The sheriffs had their ideas, the sheriff's department. We haven't really talked to the drug court, but the judges have a lot of leeway in what they do, as long as there's somewhere to send these folks. But that's most of the people in the jail system, and most of the people that they see are not just opioid, but anyway have addiction problems.
Summers, one thing I wonder if the smaller counties, maybe one good thing out of COVID is we've gotten familiar with Zoom meetings, and I think somebody in Adams or Washington maybe could tie into something more populous, say Canyon County, via Zoom.
Yeah. If you like those things, I hate Zoom myself, but they have become part of our life nowadays, and definitely useful for covering distances. Anything else that anybody would like to bring up on that? Okay, I'll sign some paperwork, I guess, before I go away. All right, let's move on. The next on our agenda is to approve the 2022 Board of Health meeting schedule, and should be in your packet. Have you had a chance to look at that? Anything longer than next week, I'd like, I'm okay, whatever you tell me, because I don't know what's coming past then. So does anybody else have any thoughts on this?
Just, I'm trying to remember, I'm writing these down in my book as we're talking here. So what's the time frame? I can't remember, for the meetings that start at 10? Okay.
January, February, March, and then December.
Perfect, okay, thank you.
Yeah, our next meeting should start at
otherwise noted, okay. 10. Here we are, down here at the bottom.
Next month's meeting
Sorry.
starts at 10.
Correct, yes, next month is at 10.
Yeah, I didn't see it on my phone for some reason yet.
It's at the bottom, these things go at 10, okay. Sorry.
Okay.
Chairman Elliott?
Yes, ma'am.
I would make a motion to approve the 2022 public meeting notice.
Okay, I have a motion and a second.
Second.
Motion and a second. All in favor, say aye.
Aye.
Aye. Aye. Okay. Very good. Thank you much. Okay, let's see. Mitch is up again. Yeah, it snuck in behind me. I can't see anybody back here. I gotta get some of those glasses like the motorcycle guys wear, you know, that have the little mirrors back there.
So this is just more informational for county commissioners. What I wanted to talk to you about, you guys probably know that we license pumper trucks for domestic waste. So they come in, they receive a license from the health department. They have a place they can dispose of domestic sewage. But last week I received a call from DEQ asking about, they had a truck full of fog waste, which is fats, oils, and grease waste. And they're like, hey, we need to dispose of this. And I go, well, we don't license that type of material. And the only game in town, as of the week before, closed down. Well, they didn't close down. They more or less said that we will no longer accept fats, oils, and grease, pumpable type waste, unless it comes from our pumper. So they pretty much eliminated everybody, which is L&R Waste in Boise. So it just kind of throws a little clog in the wheel here and potential things that could come down the road. More or less, what would happen is that Department of Environmental Quality has said that they have a couple individuals that have proposed operations plans or siting type plans where they can accept fats, oils, and grease from a commercial facility, pumpable waste, but that could be a little ways out. They're trying to expedite the process, but L&R has told them if they don't go through the exact same siting requirements that they had to go through, that they would pursue legal actions, et cetera. So really the only game in town to dispose of fats, oils, and grease, pumpable type waste is one through L&R, if L&R will actually come and pump the waste from the restaurants. They've said that they will work with people, but again, it's not in our bailiwick. And then the other one is Clay Peak. They actually have a fats, oil, and grease disposal facility, but they only take Payette County's waste. So we don't know how this is going to end up down the road, and because Clay Peak's had it approved in their operations plan, because once fats, oils, and grease solidify, they pass the paint filter test, then they can be disposed of into the working face of the landfill. What Clay Peak actually does is they have a disposal area, goes down to cleachate level, they put the fats, oils, and grease in there, they allow it to solidify. If there's any liquids left, they mix compost or wood chips with it. They'll use it in their composting, then they'll actually put it onto the working face. So DEQ's only response to this was, you know, the counties are responsible for solid waste management. So if it does come down to the point they can't find a place that'll accept this waste, that you may get pushback from, you know, commercial facilities who are trying to dispose of fats, oils, and grease, pumpable type waste. And so we're hoping, fingers crossed, that L&R will continue to work with people. There'll be other players, you know, because it's a free market game, and so there'll be other players that step into this industry. But I just kind of wanted to bring that, you know, to head. I would assume probably Canyon County with, you know, more and more restaurants than anybody. They're probably the ones that might have some pushback or might have some pumper trucks that are sitting around full of waste. And you know, our concern is that they go dump this in the middle of the desert or something. You have a whole bunch of nuisance complaints, et cetera. So, and Jeff was here from the restaurant portion of the environmental health. He can kind of just talk about what, there's not a lot of rules and regulations from the restaurants as far as how we license them, but what you were saying, Jeff, that they're required from the city level, right? So the city level pretty much requires the grease traps. If you're on a septic system, when we work with them and license a septic system, we have them to add the grease trap, and if they don't, then it pretty much just ruins the septic system. So just kind of wanted to bring that to you guys as a board in case we have more information, or if you hear information from wastewater treatment areas that are going, we can't take this waste because it's too hot, the pH level of it messes up the, you know, the microbial, however it works in this wastewater treatment plant. It's just a very delicate balance of what they can have in there. So that's kind of what I wanted to do, just bring it to you. If you have questions or things I don't know, I can get back to you on. So.
Tell me if I can do something.
If I hear, I'll let you know.
Okay.
It'd probably be, Pickles Butte would be done.
Right.
So, and I don't think they probably want it, so.
Does Dave Loper know about the problem?
He does. I forwarded it to him.
Okay.
He's like, please keep it out of here if you can. So, thank you.
Okay.
If someone is speaking, it appears you are muted in the room.
I'm sorry. I'll start over
Oh, thank you.
without the comments. Now it's time for Behavioral Health Board contract, and I'll turn time over to Nikki.
Thank you, Commissioner Elliott. So I'd just like to provide an update on the conversations that have been pretty much going since May with the Behavioral Health Board and our concerns. And last time the Board of Health met, I think it was the day before the Behavioral Health Board meeting, and, well, I know it was, because they always follow us. And I had presented to the Board of Health on an overview of our contract obligations, and as well as two options that I felt like we were considering at the time. One, changing the staffing model to support the Behavioral Health Board. It still comply with the contract obligation that we have. And then the other, to look toward terminating the contract. And so the following day, when I met with the Behavioral Health Board's Executive Committee, I went over the response letter that they had shared with us and their expectations. I also shared what I had shared with you the day prior with where we are at. And my perception from that meeting is that it was maybe not as productive as I'd hoped it would be. I was hoping we might have more dialogue about how we could move forward in terms of our relationship between the board, the district, and the Behavioral Health Board. But they did indicate that they would have a follow-up discussion and potentially provide some kind of written response. And since their meeting happened after ours, that hasn't happened yet. And they do meet tomorrow. I had met with the chair and vice chair, and they indicated that this would be discussed at their executive committee tomorrow. And if they decide to write something, they would draft it and have it presented at their next board meeting, which would be in January, which would mean we probably wouldn't see that until February. So I want to pause right there. I have a little bit more that I want to add, but I also want to give Commissioner Haynes an opportunity to share any thoughts he had. I know he attended that meeting as well.
Yeah, I was appointed to the Behavioral Health Board last month, so it was the first. Well, I guess I attended a meeting via Zoom before. It didn't feel like from last month's meeting that, like Nikki said, there was a lot of progress made. I'm hoping that changes maybe this month. We'll be here tomorrow, and we'll have that meeting. So hopefully we'll work towards something that's tenable for everybody, because I think the relationship is important for us to keep, but it has to be beneficial both ways. And behavioral health is such an important issue always, but right now, and it feels like if we can get back maybe to that mission of why are we here, then maybe we can correct the ship and get it steer in the right direction. That's just my opinion, but it feels like some of the things in which there's been a disagreement with have been pretty minor, and in the grand scheme of things, not that important. And if we can come together and work through it, then I think everyone will be better. So hopefully we'll do that tomorrow.
Thank you, Commissioner Haynes. And I agree with everything that you said. I do want to just share some things that have occurred since the last Behavioral Health Board Executive Committee meeting that I think are examples of some of the concerns that I have with regard to the contract and our ongoing relationship. I don't typically attend the statewide Behavioral Health Board meetings. They occur monthly, leadership meetings. We have representation from the Region 3 Behavioral Health Board that attends that call. And I typically get the minutes, although I'll be honest, since COVID, I haven't, it's been low on my priority list to review those. But I did happen to open the last set of meeting minutes that I think were from October, and they were pretty mundane. Each region gives an update from their area, and following my review of those, a couple of days later, I get an email from our employee that supports the Behavioral Health Board, and she had been asked by the vice chairman, I believe, to send those minutes to me again for review. They had been updated. So upon my review, she had added comments or asked for comments to be added that I'm guessing that she made during the meeting regarding a discussion that the Board of Health had and that I obviously was involved in the conversation too back in May. And some of her comments were concerning because she said, Nikki stated, blah, blah, blah. And they weren't my words. They were kind of a mix of words between a couple of board members and me, and also referenced a different district, which upon their review of the minutes called me and wanted to know what's going on over there. So it was concerning. That's concerning to me because, one, it wasn't what I said. There were things in there that were not accurate, and it got shared, with the whole state. So we have a standing meeting, as I think you all know now, with the chair and vice chair. We had a meeting last Tuesday on the 9th, and I felt it, I guess, my responsibility to bring up my concern with them about the minutes and what was concerning to me, and not just also, that the information wasn't exactly accurate that was shared, but also that it was from our May Board of Health meeting, and we've had several meetings since then, and I feel like the maybe more relevant information might have been pertinent to share during the meeting. And so the vice chair said she would consider what, my concern, and asked that the minutes be changed, and had asked me, had subsequently followed up with an email and said, how about if I change it, and had some suggested language change. And I just replied to her, because I wasn't in that meeting and I don't know what you said, I don't feel like I can really inform what you should say, that maybe at your next meeting you could clarify, what was said in the May meeting, if that's really relevant to do. The other thing that happened during my conversation with them that I didn't find out about the next day is that the chairperson had sent a text message that was intended for the vice chair, but it went to our staff, and it said, laughing my effing ass off, I can't believe she's bringing this up. And sorry, but that's what it said, and I tried to say it politely by not saying it all completely. And I feel like when I saw the screenshot of the text message that was sent during the time I was bringing up my concern, I just felt really, it's just unprofessional conduct, not respectful, and I am feeling less objective, I guess, at this point about the relationship. And another example that I would like to bring up that impacted our staff is at the last Behavioral Health Board meeting, the board voted to approve their annual report to be submitted to the Division of Behavioral Health. And at the time, during the meeting, they asked who they wanted the primary contact to be on that annual report, and they wanted it to be the chair. And our staff person put the contact person's, put the chair's information on there, and including her primary contact phone that she uses, not knowing that it was her personal phone number. So when she submitted it, she immediately got a response back that, that wasn't very friendly, but I also understand the chair's the chairperson's concern about her personal number being on a public document. So we did fix that and sent a revised version, but the chair and vice chair then had follow-up discussion and wanted to make other changes, and did, and then submitted it a few days later. But some of the communication I just feel like wasn't very respectful. The board had the opportunity to review the document and approved it, and then wanted to change it. And I feel like that communication directed towards our staff, I guess from my perspective, if I'm taking ownership of approving a document, if it has mistakes in it, that was my fault for not reviewing it in advance, and I should own that. So I just feel like that's another example where communication could have maybe been better handled between our staff and the Behavioral Health Board. So with that being said, I want to have a good relationship with the Behavioral Health Board, and I believe that's possible. But right now, I'm at a point where I'm struggling to find a way to move forward in a productive way and have our staff stay in the position that they're in. I don't see our staff working directly with the division, with the board, with the Behavioral Health Board. I just don't think she'll be staying in that position, and if nothing else, that we need to look at to have somebody else to fill that spot.
This is Commissioner Smith. I feel like I'm lost because I thought we were very clear that if the chair and the vice chair remained, we were pulling out. And so I don't feel like as a board we should say that and then not follow through. And I know that it has an important piece, but the Behavioral Health Board is very important to our community. I've heard that from a couple other board members, but I know I missed a couple meetings, but like, why are we still here? This is not okay. And Nikki is really objective, and so now to hear Nikki that she's at a point where she can't be objective, we should not have put her there.
Yeah, go ahead.
Well, there's no way of describing the relationship except toxic. I think that's a fair statement to make. And if, obviously, as a new member of the Behavioral Health Board and a member here, I essentially become a go-between between the two. So as we meet tomorrow, if there's something that this board would like me to bring to that, then I most certainly can and will. That was, Commissioner Smith, you're right, that was one of the things in which we put in our letter, and that has not changed at this point. There's also been at least 5, maybe 6 vacancies from other board members, so I don't feel like we're overreacting. I think people are voting with their feet and saying that this board isn't working, and that's why they're leaving it. So I don't think that we're overreacting or being dramatic. Other people are and people who have been there and contribute have left, and I've heard that from multiple people. So yeah, Commissioner Smith, you're not wrong in that. That's what we asked.
I think we should step away, pull staff from the next meeting, and make a stand. You're going to go, and our staff should not be subject to that. And so tomorrow's the day, pull all staff. Lyndon can represent the board and ask for a change in the leadership at tomorrow's hearing, and that it's an emergent issue, or we're not providing staff any longer.
I think that's been presented to them. I think everybody on the executive committee knows that, and they have not followed through. I mean, they have known that that's been our position for a couple of months. Nothing. And it's gone back and forth, and some of the other commissioners that are on that board had concerns on the legality that we could even ask that for another board leadership. I think that concern has been addressed by our legal department, and that it's okay. My recommendation, I'm not nearly as tolerant as Nikki. You know, I've personally, I think it's been enough time, and but I don't know whether we should pull our staff unless we just discontinue the contract, because then we're not fulfilling our end of the contract. So I don't want to do it halfway and be in the wrong position. If we're going to discontinue the contract, that's personally what I would like to do at this point, but I think it should be a clean cut, not just a, you know, ragged tear, little here, little there.
So,
correct.
Mike?
Right.
We need to follow the contract, whatever we have in place. If we want to pull away and go through the process, we need to, I do believe we have a 30-day or a 45-day or a 90-day or something like that, where we have to give them the opportunity to respond.
So, we did put them on notice 45 days ago or more that we were pulling out if they did not change. And so in a court, we gave them notice. And then also, the problem is exactly what you said. The executive board is controlling the information. The entire board is not seeing it. That's what I'm hearing from the other board members. And
I think that was true. I don't know since the last little while if that's been passed on, some of that information or not. I don't know that.
so I just feel like we've given them notice and hold the contract. If at the next meeting they put in place a new leadership committee, then this board can reevaluate a contract with a new executive committee that is functioning.
And that's the way I feel. I think that we can pull out as we do it legally, and if that leadership changes, the board changes, whatever, we can again reevaluate whether that's something that we want to participate in. But I would definitely like to have it meet all the legal requirements. You know, I don't want anybody else, state or that board or whatever, to say you guys didn't fulfill your contract and have something to be able to throw, you know, the total blame on this board. Say yes. Yeah. Okay. But yeah, find out whatever the legal ramifications are. And we have this as an action item. We do.
I have one question.
Yes, ma'am.
So, is the Behavioral Health Board, is that for the whole state, or is that
No, it's just District
just our
3.
district? And so there's an executive committee for, is it for the whole state or just our region?
Just for our region, and I know
So-
that that communication's a little bit confusing because there's a statewide leadership group too, but this is, we're talking about the Region 3 Behavioral Health Board, and each Behavioral Health Board has its own executive committee.
So my question is why do they have an executive committee if it's at all? Maybe that's what needs to be eliminated and just go back to the board, making the decisions and getting all the information all at once, and eliminate an executive committee.
It's defined in statute. It requires statute change.
Wow. Okay.
They're their own board. You know, we are acting as their, what's the right word, fiduciary person or entity. But past that, I mean, we really can't control the board, but we can just tell them that we can't work with them, you know, or fulfill our part of the contract the way that it's been going.
And Commissioner Elliott, can I just
Yes, ma'am.
Thank you. I just also wanted to make sure it's clear to everyone that the contract that we have is with the Division of Behavioral Health to support them. It's not with the Behavioral Health Board itself. And I did pulled the contract yesterday just to review the remedies in the contract language, and interestingly, there isn't a termination for convenience on our part, just on the department, the Division of Behavioral Health part. So it has to be termination for cause, I believe, and I will have to reach out to Mike Kane to figure out how we would navigate that. And our conversations with the Division of Behavioral Health through the last several months have been I know they've been trying to be helpful. They don't want to see this outcome, but I know that they, just like us, we don't have control over what the Behavioral Health Board's decisions are. So, so I just wanted to make sure that was clear to everybody.
Chairman, if I can, so I just want to make sure
Yes,
I'm
go ahead.
clear on the message from this board that I can give to that board is that, and this is what I'm hearing at least, is that the intent is for our board is to continue to move forward with the idea of terminating the contract with cause. Is that? And we can make
without
reference.
a leadership change.
Okay.
I think we can make reference to that, yes, they already know that.
Okay. Well, I was wondering if we could just make reference to Nikki's letter that she submitted to them then, that laid out, that we all approved, that laid out. Okay.
Yeah. Yeah, and I, to Commissioner Elliott's point also, I just want to make sure that we're also clear, and you can communicate this as well, Commissioner Haynes, with the Behavioral Health Board. We don't have any intention of just like terminating the contract, walking away. If it was going to continue to stay terminated per se, and things didn't change, we would still want to help that transition. However, the Division of Behavioral Health figured that out. You know, what an alternative solution for them would be, and make sure that that's they have some continuity between that change.
Yeah, I think it's a very valuable and necessary function that they're providing. I just don't know that they're doing it very well right now, you know, because it seems like, and the board members, some of the board members that I've spoken to feel the same way, is there's just, there's not good leadership right now, and there's kind of a fuzziness around even what their direction is. At least that's what I am told by certain other commissioners. And that's all that I know is a few commissioners. I don't know other folks on the board, but that's what I've been told. And so I don't know that, you know, continued infighting and problems is helping them to do their job, and it's definitely taken away time from us. Seems like every meeting here since May. So I don't know. That's just my personal thought. Is I think that a clean cut right now that's done properly would probably be benefit to both parties, to both groups.
Wouldn't that cause be because of employee being involved? Couldn't we, on just that would be the cause, I do believe.
Commissioner Abasteri, I'm not sure. When I read this language, and I could read it out loud if you wanted me to, but it's not really clear to me on what termination for what cause would meet that would meet the intent of the contract.
Yeah, right.
Easy button.
That's what he gets paid for. It's what he was educated for. So, okay. Is there anything else on that? Do we need a motion for? Okay. No motion for Nikki to continue to verify with our legal person as to how to proceed with this if there's no change.
May I ask a question for clarification and
yes,
direction?
Ma'am.
So what I think I'm hearing is I can reach out to Mike Kane to ask him about what our process would be or cause would be for termination of this contract. Beyond that, would you like me to pause there and report back to the board next month, or would you like me to proceed if, say, he says you need to provide something in writing to move forward?
Can we reference like workplace, some type of behavioral? I mean, which is ironic that it's the Behavioral Health Board. However, it is behavior related, and if you look at personnel manuals for our employees and what we're responsible to provide a safe workplace for them, That's the cause. And Mike,
a good lawyer will.
And Mike will help figure out from that, that's the cause.
Yeah, I'm not, my question, sorry, just to clarify, is more, how far do I go down this path before
And that's where I think we need to have a motion if it goes farther than that.
Right. Well, but what would the motion be? So, because I think we don't act on the contract. Lyndon goes and says the board is committed to following the letter that was sent to you on this date. If you have membership change at the executive level, then our board will re-meet, and I don't even mind if we have a special meeting for it, and then consider the contract with new leadership. And the cause will be, we will cite behavioral.
And what time frame are you putting on this? I'm seeing if we just wait, we're looking at February.
No, I don't wait. I think you ask for the resignation at that meeting. We're done.
We've already done that.
Well, then but now what we did is we didn't sign the contract today. And so now they know we're not engaging in a new contract with them. And we will not engage in a new contract until there's a change.
Okay, thoughts?
The decision is Nikki's, to be honest. I mean, we have the influence with that, but honestly, she is over the employees, and
That's true.
It should be, if she goes to Mike Kane and he gives her the direction to what she needs to do for a cause for us to get out of contract, I think Nikki takes the next step of ending the contract, whatever that is. And and she can just relay that message back to us, because we're already pretty much said that we're done.
Okay. So then basically we just are saying we support Nikki in her decision.
That's what I think.
Are we good with that?
Yeah, from what I'm hearing, is really all we're waiting on is legal at this point. We've essentially, without a change in leadership, we've made the decision to terminate the contract. We are just waiting for our legal counsel to make that recommendation or to spell that out, or how that will work. Is that what I'm?
Yeah, I think, okay, so I think I'm
Are
clear.
you happy with that?
I think so. So what I will do is I will talk to Mike Kane, to determine the termination for cause. I will proceed with termination of the contract, which is a delegated authority, so I can make those decisions, but I also think it's good to have board support. And then, unless, Commissioner Haynes, you have something to report back that changes things tomorrow, or?
Well, I'm sure they can't do that tomorrow.
Right.
That's what I'm saying. It's going to be at least another month before we even. They could resign, but they're not going to. I will tell you that right now. That's going to have to be something that's agendized for a vote for the next month.
And they're not. I don't believe they meet in December. So.
Yeah, that's what I'm saying. I think it's
February.
February.
That's a special meeting. Yeah. And I think that the termination for cause says 30 days notice, so I could put it out like 60 days or something, I guess, if we felt like we wanted to give them some grace period to convene and make a decision. Okay.
Boy, you're cold. I agree. I know that. I agree.
No grace period.
I agree. I just didn't want to make you sound too.
Oh, I am that cold.
Okay. All right.
Sorry.
I suppose the Behavioral Health Board can have a special meeting.
Yes, they can.
They can.
Yep.
And they could.
Yep.
I doubt they will. I know. It's just stuff's not getting done. That's all. People are not being served the way they should be served. I think. Just by my discussion with some folks there is all. Thank you. Thank you for your service. Good. Okay, is there anything else? Anything else anybody wants to bring? If not, then we are adjourned.
All right,
No,
thank you for
that got canceled.
joining the live stream. We'll be ending the stream now.